Hi everybody, I'm Dr. Tracy Papa. I'm a high-risk OB specialist in Fort Worth, Texas. Today's episode is a letter to my next patient. Did you know that about 10% or so of all pregnant women are referred to a maternal fetal medicine office at some point in their pregnancy for some reason? Sometimes there's a concern about your blood pressure or your health. Occasionally there's a concern about your baby. This episode is my advice to you about what to do when that happens, how to manage it, how to prepare for it, and mostly to let you know you're not alone. When I was pregnant with my fourth baby, I was hospitalized for preterm labor at about 32 weeks. It was like, what? Preterm what? What? Even if you know a lot about pregnancy and you've done all your homework, even if you are a medical professional, when something happens to you, your brain just quits. The first thing I would tell you is just stop me. As a maternal fetal medicine provider, I've seen a whole lot of birth defects, but this is all brand new to you. And sometimes we forget that you don't know what we know and you don't have the same frame of reference. So just stop me. I can explain things as many times as you need to hear it. I can try saying something in a different way. I can draw pictures and diagrams. We can go through every one of the ultrasound images and I can point to what we're concerned about. I can do any and all of these things. I can even stop talking if you'd like, to give you a chance to just take a breath, absorb some of this information, and then ask me questions. The second thing that I would tell you is make another appointment. Maternal fetal medicine problems, whether they're concerning you or your baby or both, you can rarely absorb all this information in a single visit. You're going to get home, somebody's going to ask you a question, and you're going to say, I didn't think about that, or she told me, but I didn't quite get it. So make another appointment. There's only so much information you can process in our first visit. When you come back to see me, bring questions. Write them down on your phone, bring a friend or family member or multiple family members with you. A lot of times you get caught off guard at your first visit because you're not expecting to hear what you've been told. So it always helps to bring somebody back with you on the second visit. The last thing I'll tell you is to ask for homework. Homework was never any fun when you were in school, but now you're going to be really motivated to find out everything that you can about whatever it is that we've been talking about. There's great information online and there's some not so great information online. We're going to steer you to the sites that have good illustrations, wonderful explanations about whatever is going on with you and your baby. Remember that we can also hook you up with surgeons. We may be referring you outside our practice to talk to the pediatric surgeon or the cardiologist. We can even put you in touch with other parents who have gone through exactly what you're experiencing now. Sometimes it can really help to talk to somebody who has been there. So just remember, when you get overwhelming news, stop me, come back for another appointment, and ask for homework, because these things really help. For more information about this and lots of other pregnancy topics, head over to the blog, drtracypapa.com. Don't forget to subscribe, and I'll send you more great information in your inbox every week.